Okay. So, welcome everyone. Thank you for being here yet again on a weekday evening. Most of you must have finished your clinic, and like you can see, Deepika ma'am is still, I think she's still there in her clinic. So, thank you so much for winding up your day and still coming out, supporting and listening to discussions. Like every discussion, I would like to tell you, it is open for any of you who want to think about a case, your workup, how you have worked at it. That's how Deepika ma'am and I also got talking that there are cases that as private clinicians we need to discuss together. So welcome everyone. I will just start sharing this. Um, So this is the eighth in the series, and we have Deepika ma'am with us. So as a formal introduction, she has been working with childhood language disorders since the last 7 years at Aspire Speech and Hearing Clinic at Belapur, Navi Mumbai, with a total experience of 14 years now. At Aspire, they are a team of dedicated SLPs providing audiology and speech language services across all age groups. She has been attached to various hospitals in Navi Mumbai, and she also has had the pride and honor of starting newborn hearing screening programs in MGM Hospital Vashi, Kokilaben Dhirubhai Ambani Hospital Navi Mumbai, and Thanawala Hospital at Vashi. She has also worked as a guest faculty for NIPEID Navi Mumbai for B.Ed programs. So welcome, ma'am. Welcome, and hope you have as much fun as we do in these discussions. So, and it was very commendable. I did not know you had started the newborn hearing screening programs in so many hospitals. That is really commendable because audiologists should be doing it. So,
Because there are many hospitals where just nurses or other staff is doing, and it was difficult, but yeah, it was done.
yes, you have to work through so many things. No, you have to do it. Why? What is the need? And, it is difficult to start, but it is, no, you did it in three, four hospitals. So that is really great, ma'am. So, welcome, ma'am. And you can start sharing the
Thank
screen.
you for your kind words. I'll just share my slide. Okay. Is it visible?
Yes, yes, it is. It is.
Okay, so today's case is a very simple case actually that we see regularly in our clinics. Uh, but there are certain aspects of this case which are slightly different, and how along with the parents dealt it differently. That's the only thing. So it is like holistic approach that we use with this case, and how parental involvement was very important in this case. So is it moving?
It is not moving, ma'am. It is on the first slide only.
Stuck here. I'll just stop sharing. Just
Yeah, yeah, yeah. Sure, sure. Even
minute.
I have it. If at all, even I can share the screen. No problem.
Videos won't be playing. Just give me 2 minutes.
Yes, yes, yes. Correct.
Try once again.
Yes, ma'am. Sure, sure. No problem.
Is it visible? Yeah.
Yes, yes.
So this case name is Aren. He was born in November 2018. His first developmental pediatrician intervention was done in September 21. So approximately he was 2 years, 10 months, approximately three years.
Hmm.
So these are the things listed just as it was listed by developmental pediatrician. So at that age, she diagnosed him with ASD, and she commented that his ADL was less, there was no communication, and he had low tone. So on this basis, she recommended occupational therapy and speech therapy. So he started attending speech therapy, occupational therapy immediately. He was attending it thrice a week. And that time, his occupational therapist suggested that he's too young to start speech therapy. That we very often we see this comment by occupational therapist, and their major comment was like he doesn't have any sitting compliance, he doesn't sit at one place, so you can start speech therapy only when he starts sitting at one place, because to understand speech therapy task, he needs to sit at one place, and he needs more concentration. We all know that's not true, not that's not true. After around 1 year of occupational therapy and changing almost 2 or 3 therapists, occupational therapists, they reported for speech therapy intervention in September 22. Uh, After his initial language assessment, he was recommended for hearing evaluation because his hearing screening was not done, and he had attention problems. So that was recommended, and it showed normal hearing sensitivity. So at home, he was exposed to mainly Marathi language. He was attending nursery at that time, and their mode of work communication was English. So he was exposed to both. His oral peripheral mechanism, it was normal in appearance and adequate in function. He didn't had any as such over swallowing difficulty. Even in childhood, he never had any feeding difficulty as such. But there was overall hypertonicity in his all the muscles. His tongue movements were slightly sluggish. He had wet corner of mouth, and he has had this habit of wetting his lips during talking and putting his tongue out. Uh, there was like mild tongue thrust present, otherwise also. So a general behavior, like he's happy and playful child otherwise, but he was very scared of strangers. Like whenever there is someone other than family members, he used to cling to his mother. So this was a major hurdle in our therapy, because uh, uh, cracking that thing, that removing him from his mother was a main task. So his mode of communication, like predominantly it was verbal. He used to follow simple verbal commands, one-step commands, but obviously occasionally he needs repetition. He had very good vocabulary. Like you name the category and he knew all the aspects, all the names of that particular category. Typically, that we again see in these kids. So he knew the vocabulary, but he was not able to use that. That was main problem. He used to comprehend facial expression and basic verbs like give and take, not many more verbs. His expression, like he used to, it was basically single word utterances. So if you ask him to name a picture, he would name it. But if you ask him to use it in communication, he won't use it. For communication, it was basically just dragging his parents and pointing towards whatever he requires. So, simple thing like if he wants to use a toilet or if he wants something to eat, he won't say something, he would just drag and point. It was that minimal. And then he again for if you show him picture, he could name it, but he was not using it for communication. He had echolalia. It was delayed echolalia. If he has heard some rhyme, some song, or some other thing, he would entire day he would just keep on singing that particular thing. His attention concentration, like during speech, he would give very fleeting attention, and there was no eye contact. He used to play alone. He never used to mingle with other kids or even with his mother. He never used to play. He used to love playing alone only. About ADL, earlier, like when he was 2 year old, he was toilet trained. But then his grandparents visited one day and they started commenting why he is toilet trained so early. So, and then they just started scaring him that, okay, there is someone there in the toilet. And then he got so scared that started refusing to use toilet. So that was like reverse thing that happened with him. And even in other aspects of his daily work also, he required help uh, at that time. So this is a video. This is not exactly pre-therapy. This is after around 3 months of therapy.
हे काय आहे? ब्रश. ठीक आहे. हे काय आहे? बॉल. हे काय आहे? पिलो. हे काय आहे? हे काय आहे? टेबल लॅम्प. आणि हे काय आहे? वॉल क्लॉक. व्हेरी गुड. बॉल कुठे बघ बरं? बॉल.
Okay, so here you can see that he can name all the pictures correctly. Even clock he is specifying that it is a wall clock and not an alarm clock. For other pictures also, like he used to say the specific name of that particular picture. So he had good vocabulary. So the initial goals were like to improve his attention concentration towards speech, to improve his comprehension for one-step commands, because though it was there, it was not consistent, and we would require repetition for that. To improve expression in noun plus verb form, like simple like apple day, pani ki, like that. And to improve socialization, because that was something that he was lagging. The activities that we used during sessions were storytelling with props, uh, then picture cards, kitchen sets, and pretend play. Now, these were the activities that he was most interested in. He was also interested in blocks and rings and other these things. But these were some four activities that we used extensively. Now, parental inputs. His mother is very cooperative and very hardworking. She takes initiation. She does research on internet and asks like whether we can do this for him, or whether you can use a different approach for this. How we can do the same activity at home. How we can implement this particular goal at different situations. She was the one who actually took initiative to introduce his school teacher to us, and then we had a session along with the school teacher to how the school teacher can handle him at school better. Then, unfortunately, there is no support from other family members. All other family members were against attending speech therapy. They were like, okay, he's just late for his age. He will talk because his father started talking late, so he will also start talking late. And then he has to. Then she is the only one who has to juggle between different therapies and different and school and other responsibilities as well. So after he continued his therapy for 1 year, and around at 4 year 10 months we had reevaluation, and the report was like he started following two-step commands. He could understand adjectives, adverbs, and follow simple narrative. If you are describing certain picture, he could follow that completely. He started using 3 to 4 word sentences to express himself. Whatever vocabulary he had earlier, he started using it in his communication. He started using tense and number markers adequately, prepositions, pronouns, and started narrating short stories. So a typical thirsty crow or rabbit and tortoise. Those stories he could say nicely. Uh, he's he showed great interest in written language, and he picked up reading English and Marathi pretty fast. So when he joined the therapy, he was not reading at all. There were just ABCD recognition was there, alphabet recognition was there. And just within 1 year, he started reading everything. And he had good memorizing skills as well. So he is very creative also, and he likes to work with blocks and shapes. Now there is one picture. Now here you can see that there is a kind of house and a girl, and then there is a peacock. So this is, he has not copied from anything. He has just made it by himself. And when we asked him like what you have made, he could describe it, describe everything, like these are feathers of this peacock, and this is his beak, his eyes, and everything. So for a just 4-year-old child, this was very good creativity. Now, because he started reading everything and he got really obsessed with that reading thing, we had to make changes in therapy material. Like whatever story cards we had, they had story written below that particular picture. So we had to either mask it, or we had to make different cards without any written material. So he started ignoring whatever ongoing activities, and he was just interested in reading that. So we shifted to only picture cards with no written cues, and he had delayed echolalia. So if we are telling him one story, if he has read one story, then whatever story sentences are there, he started using it throughout the day. So exact sentences that were there written in the story, whether it is Marathi or English, and with like proper Marathi. We had some old books, old Marathi books, and which are like typical proper Marathi, and still he could say those exact words, exact sentences throughout the day. Then he started imagining those story scenarios in day-to-day life. Like one day he would consider himself that he is a fish. So we had to, like every family member and all, even school teacher had to call him fish. You cannot call him by his name. You have to call him by as a fish. Only then he will respond. So he started so much focused on that particular character. So we had to limit his exposure to written material and change his therapy environment to outside clinic. Like our the clinic is in a market area, so we have different shops outside clinic, just adjacent to the clinic. So we started visiting these shops, and I would go earlier and tell them earlier that okay, this is the situation. And then like there is one optic shop, so we would go to that shop, and they will discuss about different spectacles, different goggles, and what all machines are there. And then there is one tailor, there is another courier shop also. So we used to discuss things about her. Good thing was he started using those sentences in communicating with others at school or other places as well. He started communicating with vegetable vendors, and like if he's going to any other shop, then he started using those sentences over there. uh, but again, he became more and more clingy to his mom. So he was comfortable with therapists like occupational therapist and speech therapist. But otherwise, if there is any stranger, he used to again cling to his mom. Still, he was not taking any initiation as such to start any topic or any communication. Some days he will repeat just storylines and there is no communication at all. Some other days, like he will just pretend that he is one character and he would be in that character whole day. So in this video, yeah. So these houses he has built, and this is this entire game he has started. So these sentences, so these sentences like कोंबडी कोंबडी दार उघड, काय रे बदक दादा काय झालं, these are from his storybook. So he is using same sentences in his pretend play as well. Uh, After discussing with other parents and doing certain research, uh, he was enrolled for gymnastics, and then that helped him in improving his concentration and muscle tone. There he started interacting with his peers, like the other gymnastic kids, and then he started interacting with them by himself. So he started taking initiation over there. So and he was enjoying that thing a lot. So we developed therapy activities along those lines where we would pretend to be in a gym class. So he would do certain activity that was taught in gym class, and then we would discuss that thing. So after that, when he had his developmental pediatrician visit, during that visit, the developmental pediatrician commented that there is very good improvement in his language because he was using those rote sentences. Those were from the story, and those are actually very good sentences. And she suggested you can now discontinue speech therapy. Luckily, unluckily, grandparents were accompanying him during that developmental pediatrician visit, and they were like, "Okay, आता तर सांगितलं ना, मग आता बंद करूया." So they forced the mother to stop speech therapy. Now again, mother was reluctant because she knew what exactly the scenario is. Uh, so we gave him some activities to carry at home, and the mother was continuously in contact with me every week. We would have a phone call, and then she would tell me what the improvement is there, how we can further have more activities with him at home. So we took around 2 months break, and within those 2 months break, the grandparents realized that no, we need speech therapy. So we had around 2 hours counseling session with grandparents, and then they agreed and they gave go ahead to again start therapy. So again, he started therapy once a week for around 4 months, and after that, because his school started and everything, so we discontinued therapy like regular therapy. Now he's attending once a month, and currently our goals are mainly towards topic initiation and maintenance and improving his social skills. So what worked for this particular case is storytelling. It helped a lot initially to improve his attention, concentration, and sentence building and improving MLU. Like initially, he was just not using any communication, just pointing and dragging. But stories helped him quite a lot in improving his confidence and that sentence building. Pretend play. So, as he had delayed echolalia, he could use sentences that we used in pretend play for his daily activities. So, if you are doing kitchen, if you are playing with kitchen set or with a doll, then the same sentences he could use at home for for his basic needs and other things. Uh, we worked on ADL as well, not directly, but indirectly, but that improved his self confidence. He's still not toilet trained, but is work in progress. But at least he's not scared of toilets right now. He can visit a toilet, but still he's not informing whenever he has to use the washroom. Gymnastics help him a lot to improve his muscle tone and confidence. Luckily the instructor over there is well versed with the demands of special kids, and he handles them accordingly. His fidgeting also has reduced quite a lot. Now, school is like integral part of any child's development. So, as the mother took initiative and we had a discussion, we had a session with school teacher. So we discussed his strengths and limitations, and the teacher was very helpful, and she also started using therapy techniques in school as well. So that also helped quite a lot. What didn't work is again a storytelling, because though initially it helped in improvement, soon he got too attached to those story characters. So that actually hindered our progress and our activities as well. Again, reading, he's a very good reader, but that helped, that actually was a block in our therapy progress. So this is a video, this is last video. Here you can see he's reading
There is no audio, huh, ma'am? If this thing, I can't hear anything.
It's it's Bhagavad Gita that he's reading.
Okay.
There's no audio at all.
No, no, no. We can't hear anything. We could hear the previous videos.
Okay, I'll just play it because there is quite a lot of static noise in the background.
Okay, okay.
Just play it again.
Yeah.
Let's.
No, ma'am. There's no audio.
Can you hear the static noise?
No, nothing.
He- He's just reading that Sanskrit shlok, which is
Shloka.
Bhagavad Gita, and he's
Okay.
reading it correctly. So
Okay.
that
Okay.
difficult Sanskrit pronunciation also he is able to read it
Yes.
correctly.
Manage it
Yes, he's
correctly.
managing that very well. So thank you for your attention. Now, as we say, the like case is open for discussion. I'll just stop sharing.
Yes, please. So if any of the participants you want to pick up any point and discuss with her, you can either put it in the chat box and unmute yourself. Till you do that, I will start. Ma'am, first tell me about the 2 hour counseling session that you had with the grandparents because it is important as family members that you do it. But understanding the power struggle because I think for the therapy sessions, obviously the father might be paying, and still they have so much control in the decision that whether you should go for therapy, that you should stop therapy. And the first thing which you said was the toilet training. They scared. Why is he toilet trained so early? You mentioned that he does not have other independent skills. He needs help, and he had achieved toilet training, and then it went back because of these fear tactics. So, please go on. Please tell us more about that
Because
counseling.
his family dynamic is very different. Like his
Okay,
father is not against therapy, but he's not
okay,
supporting also. So
okay.
he's someone like, okay, I'll pay for the therapy, but rest of the
Hmm.
things you have to handle, like
Okay,
commute and then like managing sessions and everything. Because thrice a week he had occupational therapy, once a week
correct,
speech therapy,
correct.
and again school also. So handling everything by a single mother is like very difficult.
And the
Uh,
home and the house
yes,
aspect,
obviously,
possibly the
that's a huge
cooking for
responsibility.
everybody. Correct, correct. It's a huge
And
thing.
then initially the grandparents were not staying with them. Then suddenly at around 3 years, like just before that first visit to developmental pediatrician, they shifted to their place. And before
Okay.
that, she had toilet trained him. And then they commented like, "नाही नाही, तिकडे काहीतरी आहे toilet मध्ये." And then obviously that being
That
a
is
kid,
a,
he got
yeah,
scared.
that's a fear tactic. That's a completely
And he
unnecessary fear
was
tactic.
so scared that even if you put that potty seat outside, he won't sit on that.
Correct.
He would just poop in his diaper only. That was his
Okay.
condition. Right now, with so much counseling and we had pretend play also, just concerning that thing for one session. So
Hmm.
now at least he will inform that, okay, I want to use washroom, but he won't go into in the washroom as such.
Correct.
He will poop in his diaper only, even now, even
Okay.
at around 5, 6 years age.
Hmm.
So that's how much
Correct.
those grandparents were affecting him. Uh,
Correct.
the counseling session that we had, because they forced the mother to stop speech therapy, and when he was at home for 2 months, he was with them obviously. So they observed that okay, what all he's lagging, like he's using the same sentences that he had learned earlier. He's
Correct.
not going ahead. He's not using different sentences. I don't know
Absolutely.
why they didn't realize it before because they were staying together. But that 2 months gap actually somehow made them realize. But still,
Hmm.
they were not ready to start therapy. Luckily, they were ready to come here for counseling at least. So during
Hmm.
counseling, like my major focus was to make them understand what is actually communication and what is just
Hmm.
rote memory. Like
Absolutely.
he is just memorizing those sentences and using those sentences only. So we need
Correct.
the child to actually use his own sentences. which
Absolutely.
he had started using right now. He's using few of them, but not completely. Now we had I have actually not mentioned that, but we had to work on his that tongue thrust issue as well. Again,
Hmm.
for that also they had this reluctance that no, his father also had this when he was a kid,
Correct.
but he doesn't have any issue right now.
Hmm.
His father has lisping,
Okay.
but
Okay.
obviously it goes.
So
No one pays that much attention to that. So,
absolutely, because as an adult, he's
right,
functional in so many other things,
right.
functional, successful. Absolutely.
Sorry. So, and obviously we can't just point it out because they
Correct. Absolutely.
so, but then I had to explain them what this could lead to, and then somehow they agreed for therapy.
Hmm. Okay. Uh, no, no, that is the reason I really wanted to know because, if this is going to be so much hindering and the mother, like, for example, this toilet training thing that you said, it became a separate battle for the mother. Something that was done, conquered, a done chapter. It was again opened and it became a new battle totally. So another two things I would like to point out over here is you said the typical thing that the OT said that you need to sit, the child has to be settled for speech therapy. Apart from the child being ASD, a lot of kids who have a year of occupational therapy and then they come to us where the beginning of pointing or some other sort of communication that we start with and we train with, they come with this list of vocabulary because, that is how a non-speech therapist is going to train. They are not going to focus on communication and function, and the child lands up with such a big vocabulary of not knowing what to do with that vocabulary.
Flashcard therapy, like this is this, this is it, this is this. They literally had that
Correct.
set of flashcards for each category. And the
Correct.
mother being so hardworking, like she had actually took the photographs and made flashcards for
Yes.
each category. She had like boxes of these categories, flashcards.
Oh, yeah, that is the typical, right? That this is the starter set, this is the, uh, you know, the first word set.
That's still okay, but she like vegetables, vehicles, and
Yes.
thing. And like he knew all this, but then he was not using them in communication.
Absolutely. That is the whole, the grief about it. You don't
Yeah.
use it in communication. And because you've built up so much, there are other family members who is going to say that "Oh, he knows it. He knows this. He knows this. So what is your
Grandparents,
problem?"
he's so smart that he can name anything that you show him. You
Correct.
have to explain that, okay, just naming a thing is not communication.
Absolutely. I would also point out two things, just listing it and joining the dots because we've already mentioned it. I just wanted to put it forth to all our audience. Being a rote learner, also, having this so much echolalia, one, you did not stop. You obviously worked at echolalia as a strength, but such a child functioning in the shops outside, that activity which you did, and that magnetic tiles that he made, it shows so clearly that a different thought process is evolving just because a speech therapist is involved. Otherwise, you would have never worked on the thought process and you would have completely gone on hidden messages which are there in that echolalia. It could be intention, it could be some thought, it could be referring to something which happened, some other day, and it would all be echolalia. Those two things that you did, it is such a nice graphic of how the child's mind is working, that even though he's using the same sentences for pretend play, he created the pretend play himself. That is that is so great, basically.
No, his creative skills are really very good. It's like there is one game Tangram. Like there are seven
Ah,
guys
yes,
and two
yes,
and you will be amazed. Like you just give him any difficulty level, and he solves it in 2 minutes.
correct. No, no.
Like
So his language and visual skills are extremely good, but
yeah,
it should not hamper the communication where the ultimate line is okay for his activities of daily living. He needs help.
yeah.
So then that is not helpful to the child. And there's a comment here. You mentioned he used pretend play sentences at appropriate places outside. Can you share some examples?
Right, like if you are playing a if you are playing with a doll, and
Ah,
bathing her, or I'm like, okay, चला आपण आता कपडे घालूया. So he
correct.
same sentence when he's actually wearing clothes. So if I have used
Okay.
चला आपण कपडे घालूया, so he will use same thing when he's wearing clothes. चला आपण कपडे घालूया.
Okay, so he used that. So, and just in case there are non-Marathi people who don't understand Marathi, so he, as an echolalia, he used, okay, let's wear clothes as a part of his echolalia, and he managed to use it when he was actually wearing the clothes by himself, basically. So,
So
and that
like
is using the echolalia's strength, right?
yes,
That is,
yes.
yes,
Once like we had we were playing with kitchen set, and we had like pink cup and yellow cup, and
correct.
uh, then at home like his mother was giving tea to some guest,
Yes.
and he didn't use any ecolalia, he didn't use, but he just asked why we don't have yellow cup at home, because that was his cup.
So that is so great, right? And you saw that apart from echolalia, look, there is a complete individual thought process which is evolving. And see, he was thinking about it, but he had no sentence to put it forth
Yes.
because of the speech intervention, the language intervention, the language and the thought developed, and he could use you used the echolalia for his thought process. Is what I want to highlight basically, because there is a lot of play and a lot of other things, like you say, non-traditional things which you had.
Non-traditional.
Absolutely, absolutely.
I guess that answers the question.
Yes, yes. So he used, yes. He also invented pretend play. I think the highest mark of the child developing the thought and understanding self-engagement is definitely playing pretend play. Even though you're repeating the sentences, you still manage to initiate the game and you started a whole new game by yourself. That is amazing. Like that is the fruits of your labor, basically.
And I have not mentioned, like we use worked on his socialize. I guess we are getting late, but yeah, I just mentioned that.
Mm,
So we were working on socialization. Like we made him to visit different places, and his mother sent me a video just last week where he is helping a local temple, and they had like this what you could say kirtan, and they were
ah,
playing,
ah,
and he's playing a dholak, dolki.
okay. Yes.
Yeah, so he was playing
Ah,
a dolki with to support that abhang.
okay.
So there
Okay.
he's like interacting with all those like elderly people who are there, and then everything is like he's managing very well over there.
Okay, okay. So, ma'am, tell me something related to this socialization. You specifically said that after he joined gymnastics, his tone, attention, as well as socialization improved.
Yes.
So, like, how was the OT participating here? Because you said he has been to three OTs in across 1 year, and they are also supposed to look exactly at this.
Uh, Unfortunately, before joining speech therapy, he had changed three occupational therapists, and then
Okay,
after that, I guess he's with the same occupational therapist. So occupational
okay,
therapist mainly is was working earlier on like setting compliance and attention concentration. Then
okay,
a little bit on right now, I guess they are working on finger grip,
okay. Fine motor. Yes, yes,
fine
yes.
motor skills,
Writing
and
skills.
obviously ADL as well.
Okay.
His the current occupational therapist, like he is doing very well. But what helped him better, other than like occupational therapy, is gymnastics, because there like he was doing like gym exercises, and he was
Hmm,
actually,
hmm, hmm, hmm.
because he was using rope malkham also. So
Okay,
that was that helped him quite a lot. It gave him confidence,
okay.
because earlier, like because of low muscle tone, he was not much mingling with kids, not running, not jumping much. But with this, he started doing all
Yes,
those.
because you said the gymnastics, it was obviously the low muscle tone which was affecting all this. But we are generally going to say that yeah, it is behavior and you're not sitting. That is not correct. So, ma'am, here is another comment from Sushri Smita. For children who struggle with sitting tolerance, we, the speech therapist, can always incorporate floor-based activities or work in environments where the child feels more comfortable. Our goal is to integrate speech language learning into dynamic interaction. But mostly occupational therapists and sometimes pediatricians recommend not to go for speech therapy until they develop good attention and sitting tolerance. So how do we handle this? You say, then I'll say something. You say. Because you have interacted with hospital staff. Know how the fight is.
So unfortunately, unless the kid comes to us, we cannot handle this. Once
Yeah.
this
How do
kid
you get to the parent? How do you tell the parent ki bhaiya it works like this?
For this particular case, actually, the mother realized after 1 year of not having speech therapy and just having occupation, she realized that okay, इससे नहीं होने वाला, हमें speech therapy लगने वाली है. So that
Correct.
here in this case, I never had to counsel the mother as such. I had to counsel other like grandparents and father, but never the mother. So this case was sorted. But yes, I have other few patients where like they come and they say, okay, we have been recommended to continue occupational therapy for 6 months and then come for speech therapy.
Speech therapy.
There, we just have to counsel them that okay, speech therapy is not just sitting at one place and showing flashcards because every
Absolutely.
that particular image in their mind that okay, this what this is okay, this is ball, this is pencil, this is bottle, this is what we do for speech therapy. Speech therapy is much more than that. We work on
Correct.
not only just speech and language, we work on many other aspects also. So
Absolutely.
once you counsel parents that okay, this is what we do, we you just have to explain what the particular child's limitations and how we are going to work on that. I guess most of the parents understand why it is.
Yes. I would like to add to what you said. So this is when the parents are coming to us, and by that time, most of them are regretting. Once we start, and like she has mentioned very correctly, we do have a lot of movement-based activities. You cannot force a child to sit unless you are following one particular plan where you are going to, give one reinforcement. I think, we have genuinely moved away from that because we are getting children across different, not just the spectrum. I would also request all of you today here, talk to the other professionals who you are working with. It could be your occupational therapist, it could be the physiotherapist, it could be the special educators, because special educators do require the kids to sit. So it is a very important demarcating boundary that as speech therapists, we don't need them to sit. It is okay if they move around. Whereas educators, because they are working on certain literacy concepts, talk to your colleagues, OT, PT, special educators, and very importantly, go back to the referring physician. Talk to the developmental pediatrician. If they are open, they are going to listen to you. And even you can tell them that I can start with the basics of communication. At least I can counsel the parent that, instead of dragging, how could we work on pointing, gestures, imitation? This can definitely go side by side. If the OTs or the gymnastics, like you said, if the hypotonia is worked on, it is extremely beneficial for us. But till then, let not that gap come in where there is this vocabulary built in, or the mom is doing OT but the mom has no idea how to structure the talk. There is no visual scheduling, there is no predictability or telling the child that this is going to happen. So you come across a very defensive child that my toy will be taken away, like you said. Now I will do toilet outside because there was no notice given to this poor child. So step up, keep your professional boundaries, be polite, but be very firm in saying that we are completely capable of handling children who are not sitting, who don't have their attention in place, and who have hypotonia. Because there are several things we work at even before we touch a picture. Even, pictures can even be on the floor if at all we want to introduce pictures. But there are so many other things, including counseling parents, that require to be done before a kid needs to sit. So I hope Sushmita that both of us were able to help you a little bit, maybe on the advocacy for our profession. So I think anything else, ma'am, you want to share?
Actually, this is like very lovely kid and he's so attached. So I can talk about
Yes.
him for entire day.
And it is sad to see, these other factors coming into play where suddenly therapy is stopped or somebody else takes a decision. The entire battle is the moms going to therapy, school, looking after the house, looking after the very in-laws who are, creating. So the counseling session, I hope, made a lot of headway into what you just.
நாலு நாள் ஆகும் brother. ஆ? model. Okay.
Okay, ma'am. Somebody else's.
Can I just add a little bit here?
Please, please, ma'am. Please do. Please
Yeah,
do.
yeah. Okay, my name is Vijaya. I graduated in 94 from Aish.
We have a super senior with us. Welcome,
No,
ma'am.
no, no,
Welcome,
no,
ma'am.
no, no. Seniority is only in terms of experience. So I just wanted to add a few points here. It's commendable regarding the newborn hearing screening that you're working on. Okay, I also work in a community hospital, and we do about 1,500 to 1,800 babies we screen in a year. Okay, so
Okay.
that is our birth rate is very high. We have a very good, very strong gynec department. So
Hmm.
what we do is we take that opportunity by the time we are feeding in the data from the equipment to the system and we are printing the report out. That 2 minutes we are using it to counsel the parents regarding screen time and starting off with books as quickly as they can and feeding without a screen. How they could use soft
Absolutely.
solids at 7, 8 months as a way to, talk to the child and connect to the child. So that is one thing that we are very strongly doing now. And
Brilliant.
another point, mine is an audiology cum speech pathology setup. So audiology is where I earn my bread and butter, and speech pathology is what feeds my soul. Okay, so I'm just being very bluntly honest here because
You
mine's a
should.
community hospital. Our tariffs are abysmally low. Okay, so
Correct.
what I'm doing is I'm doing completely a parent empowerment based speech, therapy. I love to do, but I don't have the time and energy. Like I'm 52, so I really don't have the strength to go through 5 sessions of therapy, continuous therapy. So I'm working on purely through parents. And
Hmm.
how I ensure that is I ask them, what is your concern? And I
Absolutely.
handle that first. I set
Correct.
up goals, but I take about one to 1.5 hours with each parent and child. And I explain to them very clearly why I am asking them to do the activity that I am telling.
Okay.
So, if there are juniors here, there are a couple of points that I really would like to make. First thing is, don't try to shroud speech therapy in secrecy. Don't
Correct.
make the sessions closed door. That is my honest
Absolutely.
request. Keep it
Absolutely, ma'am.
open. If you are talented and your basics are strong, nobody can take your caseload away from you. No one can do it. Absolutely not. Okay, your choice of words, your choice of understanding, how you understand the parent and how you put forth your home training program makes a huge difference to whether they come back to you or not. My
Absolutely.
children, meaning the children whom I worked with, there's one child who is 21, he's attending college, but I still am in touch with all his milestones. So that's the kind of impact you have to make on the child's life.
Absolutely.
Okay, so that is one thing. So take the parents, concerns is one thing. Don't shroud your sessions in secrecy. There is nothing that somebody will take away from you. And we as speech pathologists, we as professionals should have very strong basics. If you tell a child do matching, you should know why that child has to learn that
On
concept.
the market.
Why that
Absolutely.
child should have joint attention, why that child should have turn taking. Do you know that first? You understand, you can put it across well, and parents will come back to you.
Absolutely.
And for
Absolutely.
the raising caseload that we have, we cannot work without the parents' support.
Absolutely.
Absolutely impossible. Just not happening.
Absolutely.
Yeah. So this is, I
Ma'am,
don't know,
of
I might have come across strongly, but this is what
No,
I really think.
absolutely not, ma'am, because more of us need to practice this. We are
Yeah.
doing this. We have gotten our degrees, and especially this fear that especially non-SLPs are not going to take your caseload. The
Yes.
especially the fear is individuals who are assistants or who come even from a non-teaching background that they kind of do this and parents move to them because obviously their rates are much lower than coming to a private practicing clinician. But that is the truth. Today, at 4 years of age, if you're able to advocate for the child using the term neurodiversity, that I'm going to talk for your child, I'm going to always advocate for your child. Please understand that where his differences lie, then I can work on your strength. Use this sentence, ma'am, like you said, and you guarantee the parent is going to come to you and not go to any other non-professional. Trust me.
Yeah, absolutely. And another thing is, even I've been in the same hospital for nearly 25 years. I've been in the same setup. Okay. So I have also had immense, what you say, resistance to having early referrals. So I would have children come at 3 and 3.5. So this did not work. I knew it was wrong, but it takes a lot of time, patience, and you have to behave professionally to be respected.
Correct.
That is very
Absolutely.
important. Yeah. And another thing is I started working through the PGs. I did not go to the HODs. I did not go to the registrars. I did
Yes.
not go to the top people. I started down.
Yes.
So that is
Absolutely.
where I started. And again, your basics well. If you tell them this is what it is, they understand that you come from a place of understanding and experience. They respect what you say. And now we are having referrals of children as young as 18 months.
That is
So,
commendable, ma'am. That is
yeah,
absolutely commendable. The
so
grassroots work that you did, the
yeah.
bottom up work that you did.
Yeah. So, but
Hmm.
it works. Patience and persistence pays. So another thing that we did was April, we have these TVs that run in our hospital. So we kept putting a lot of stuff on autism awareness, red flags and stuff in colloquial language. So that worked. I think I have taken up a lot of time. So if somebody
No,
else wants to go.
it's absolutely fine. It is meant for these discussions because, like I said, ma'am, one at a time. If I talk to the five OTs I am in touch with, those five OTs get to hear it from 25 speech therapists that they know, ma'am, then there is going to be a change. No diktat or law or amendment is going to get this change. We have to work towards it, right? So,
Like I said, it's very important that we behave professionally, use the
absolutely,
right scientific terms, have our basics right, and show
absolutely.
them that we come from a place of understanding. We know what we are talking about.
Absolutely. And ma'am, that therein, whether we are talking to a professional or whether we are talking to a parent, like you mentioned about matching, something as very simple as matching. If we tell them things which are 5 steps ahead, so I'm looking at visual scanning. Can the child scan on the table? Can the child scan on the wall? Can the child scan and then execute a command? If we tell them four different, the four stations which are going to come ahead, instead of getting the parent only to look at the platform where you are standing, it is definitely helpful both for parents and any other co-professional that you are talking to in understanding that, oh, they have a plan. It is not what is just happening on the table. There is a lot which goes behind every session with every parent and in general the science behind it. So that was absolutely lovely. And I love the fact that, she
Mhm.
participated, Vijay ma'am, she participated.
Thank you so much, ma'am.
So thank you so much for that. I am going to briefly share this with you. 1 second. So this is a very small token of love and appreciation from Insightful. Thank you so much for
Thank
accepting.
you so much.
Thank you so much because one topic of discussion see it leads to another where we all are genuinely interested in sharing our own experiences as well. So it was a lovely case discussion. So thank you so much, ma'am, for accepting this,
Thank you
and
for inviting me.
it was really nice. I would also like to shed a little bit of light on what is coming up next on this very Friday. I had the opportunity to interact with a couple of senior parents, real veteran parents who have really researched into what they are going to do next. These are being parents of adult children. They are 25, 26 now, and they have been really looking at future living options because they know their children won't be caring for them. So we have a parent, Mrs. Swagata Banerjee. We have a parent who is the director of Astha Charitable Institute, Mrs. Patil, who also runs Avdut Residential School for the Intellectually Disabled, and she's a parent of a CP child. And then there is our own very senior, Mr. Shilpa Huzur Bazar, who is involved in this trust and this institution as well. It is going to be a panel discussion on what is assisted living, how parents are looking at care options, what kind of finance planning are they looking at, and how they are looking at life post 55. Even I had never thought about this. It is because of interaction with few parents that I got to learn how they have been investing, how they have been thinking from the time the child was in teenage. basically. So I have invited them for a panel discussion. I hope you know, people who are attending today, it is equally helpful for both parents as well as SLPs, because like you said, even after they discontinue with us, they do look at us for guidance and help. So if we learn from senior parents, we have many more things to tell them and discuss with them as well. What are the options? Why look at assisted living? What is assisted living? How do you work with the family structure? What about the parents' own work? So these three ladies, you know, super ladies, have very kindly have agreed to meet at this time. And even if you are not able to attend at that time, the recording is going to be available. So do register, if at all, connect with me, and then we can meet on Friday as well. So thank you everyone for being a part of this. Thank you, people, for turning up on a weekday evening after your clinic practices. And good night, take care, and we hope to connect next time. Bye, ma'am. Bye. See you.